Welcome to Calm, Cool, and Connected. For several years, we have been experiencing what is an opioid crisis. And that's why I'm so happy to have part of the team from Chesapeake Integrated Behavioral Health here with us today. So, welcome Danielle Collins-Facto, Licensed Program Director, Kristen Martin, Certified Prevention Specialist, and David Dillon, Certified Prevention Specialist and Clinician. So, Kristen, can you go ahead and give us a little bit more information on how to recognize misuse versus use of opioids?
So a lot of times when people are using, you'll see a lot of behavioral changes. You'll see a lot of mood changes. They may start retreating and just trying to be very isolated. They also may stop enjoying things that they typically enjoyed before. So I'm a huge dog lover. My dogs are my own personal coping skills. So if all of a sudden I don't want to hang out with my dogs anymore, that's a big red flag that something's going on. And we also want to make it a point to help people identify what an overdose is versus someone who's experiencing a high from an opioid. And this is something that David will expand on when he talks about our Revive program that we participate in. So if you have someone that's high on some kind of opioid, they're gonna be very, very relaxed. They're gonna be kind of sleepy and drowsy looking, but they're gonna have a normal heart rate and pulse. They're gonna have a normal skin tone. They're gonna kind of look a little different and sleepy. But on the flip side, if you have someone who is overdosing on an opioid medication, this is a huge emergency. And this is going to be something like very pale and kind of clammy skin. For lighter skin tones, they're going to have blue lips and fingertips. For darker skin tones, it's going to kind of look like a grayish tone. They are going to have some issues breathing, whether it's infrequent or stopped altogether. They may experience kind of a deep snoring or a death rattle kind of noise. And when you experience any of these and you come across someone who is experiencing any of these, this is an emergency situation. And this is very important.
Kristen, tell us a little bit more about the death rattle in terms of what to look for.
It'll be very, it's a sound you've never heard before. It's very scary. It's like they're gasping for breath. And when they gasp for breath, it literally sounds like a rattle, like a baby's rattles going off in their chest. And that's kind of that moment where you go, oh my goodness, this is when we need to call 911 and initiate this process that we talk about in our Revive training.
Thank you so much for sharing, because I think that that's a top indicator that someone is overdosing, and also the behavioral changes that can happen.
Yeah.
So I know that you mentioned that David had some information regarding the campaign. So David, could you give us a little bit more information in terms of what campaigns you all participate in?
Yes, absolutely. The first campaign we'll talk about is it's a harm reduction. And Kristen mentioned we offer a training called Revive. It's Virginia's opioid overdose and Narcan education program. Basically, this training helps people learn how to recognize and respond to an opioid overdose emergency by administering Narcan, which is a medication that can reverse the effects of an opioid overdose. We also discuss risk factors for overdoses and common myths about overdose reversal. These trainings are always free, and they include a kit with supplies that you would use during an emergency event. And also we offer free Narcan for those who request it.
What a valuable program and resource to offer folks in the community, and especially individuals who would like to get more deeply trained. Thank you so much for sharing. That's so vital and very important. So speaking of treatment methods, could I hear a little bit more from Danielle in terms of what kind of treatment options do you all offer at Chesapeake Integrated Behavioral Health?
Yeah, that's an excellent question, Rachel. And CIBH offers a multidisciplinary approach to treating substance use disorders. And we definitely want everyone to know that recovery is possible and there's help available. It's just a matter of knowing how to access that help. At CIBH, we offer same-day access, which means that an individual does not have to have an appointment to initiate services. And services could include outpatient therapy on an individual or group basis. We also offer medication-assisted treatment, which is often vital when we're talking about opioid use disorder. We have certified peer recovery specialists available who are individuals who have lived experience with mental health and/or substance use disorders. So they really can sit down with the individual and help them walk through their path towards recovery. We also have medication management for substance use disorders and/or mental health disorders, and case management, which can work with the individual to coordinate services, whether it's services at CIBH and/or the community, and link and monitor them to additional services that they might need.
Danielle, you said one word that just really stood out to me, and it was comprehensive. And certainly everything that you described is a very comprehensive packaged program. It sounds like for individuals who are in need. So thank you so much for sharing. Now, how could folks get involved in one of your programs to receive what sounds to be wraparound services?
They would simply need to call 547-9334, which is the main phone number to CIBH, and simply just state that they need help. They need to, engage in services to treat, an addiction, or maybe they're struggling with depression or anxiety, which of course we're seeing a lot of because of the pandemic. And oftentimes that first step is the hardest, but we are here, we're available. You don't need an appointment. You just need to pick up a phone and make a phone call.
That's wonderful. And then for folks that are just needing mental health counseling without substance abuse treatment, can you speak to that?
It's the same process. We offer the same services, the same wraparound comprehensive services. First, assessing the individual, identifying what are they looking for, what do they need, what are their symptoms, and linking them with services within CIBH or externally. Perhaps they need medical treatment for a chronic condition, then we could help facilitate that linkage.
That's wonderful. Well, thank you so much to the team at Chesapeake Integrated Behavioral Health for being here, because this is such an important topic and just resource for folks to know about. So thank you.
Thank you for having us.
Thank you.
Absolutely.
Thanks so much.